Hello, my name is Vincent Trinh, and I'm a registered nurse based in Southern Oregon, where I work on a tele-step-down / COVID-19 unit at a small hospital, and I've been there since April 2020. For me, being a nurse day by day means caring for my patients and improving their lives, and for me, it's more than just a job. It's really a calling for me because healthcare goes beyond the hospital. It's about empowering individuals and communities with health education and transforming inequity within the healthcare system. So I want to start by sharing why I chose to become a nurse and what has really motivated me to pursue a career in medicine. It all stems from both my immigrant upbringing and personal trauma. As a child of an immigrant, my parents fled Vietnam on a boat after the war ended and embarked on a 7-day trip to a refugee camp in Indonesia where I was born. They had barely enough rations and clothes on their back to sustain that trip, and because of their challenges and hardships, my parents have always stressed the importance of education as a means of creating a better future. With the importance of education ruminating in my mind, in 2012, I graduated at UC Davis with an English degree in the pursuit of becoming a journalist. But at that time, I was with someone who had leukemia, and that has forever changed the course of my life. I worked at a public radio station as a producer, but soon left the job to be my late partner's caretaker. And after 5 months of watching her battle her leukemia, she unfortunately passed away. So as a result, I was traumatized, and I really need to find a way to process that grief. So I joined a nonprofit organization that focused on finding stem cell donor matches for minority patients living with leukemia. And I work as a videographer for them, where I had the privilege of documenting individual stories at their bedside. And it was a very fulfilling but very heavy job. Heavy in a sense that there wasn't really anything I can do from a clinical standpoint. And so upon reflection and realizing how much it was the nurses that made an impact on both my late partner and the patients' lives that I documented, I decided to go back to school to become a registered nurse. So now as a new nurse working in a rural hospital during a pandemic, on most time, it's a very challenging experience, one that really truly pushes both the clinical staff, myself, and patients' resilience. For instance, watching family members say goodbye to their loved ones while being admitted as inpatient, or when your patient is decompensating and you're the only person in that room, that can take a lot of mental toll on both the caregiver and the patient. So my day-to-day consists of rising above those challenges and advocating for my patient when they're unable to do so, making that difficult phone call, holding a patient's hand when they take their last breath, but on a positive note, celebrating together after recovering from what appears to be one of the worst moments of their lives. To share these moments with the people I care for has been one of the most privileged aspects of becoming a registered nurse. I hope in the next 5 years, I will obtain my master's and become a family nurse practitioner and work really closely in my community. I truly believe that healthcare stems far beyond the hospital setting, but rather it begins by empowering the public, health education, and bringing equitable balances of healthcare resources to those who have been far too marginalized. Which is why, as a nurse, it's important to not only deliver safe, high-quality care to our patient, but it's also equally important to be curious about our patients' stories, providing them space to advocate for themselves and take genuine interest of who they are, which is why as a future nurse practitioner, I hope I can continue to bring that message into healthcare, to not lose sight of the people we care for as another statistics, as another body, but as someone with a rich narrative and lineage of cultures. Right now, I'm currently working on many creative projects that helps to integrate both storytelling and nursing. And I'm currently working on a podcast and photo projects to help convey this message to the public. Because after all, it's both the patient and healthcare worker stories that really truly inspires me to do what I do today. So if given the grant opportunity, I hope to invest in it in my education, my loans, but also my creative projects as a means to focus on empowering voices for patients and healthcare workers. So I just want to thank everyone at FIGS for taking the time to listen to my story and allow me to be part of a community who are truly the future faces of medicine.